Morning, Dr. Denise. Good morning. It's good to see you again.
Good morning. You are the first person that has pronounced my name exactly. Denise. Thank you. Good morning. I'm
Morning.
so excited.
It's all
Good
right.
morning.
Let's leave you to it so you can get on with your
Let's get on
conversation.
with this thing.
Yes.
Thank you. Good morning, viewers. Welcome to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo, the CEO of Come With Cancer Foundation, in partnership with AIT. Together we fight, together we win. Today it's a new month, we're getting to the end of the year. Let's look at it. We've also got a new chapter in the cancer care space with Professor Monisi, who leads the Nigerian Cancer Society. Prof, good morning. It's very nice to see you again.
Yeah, good morning. Thanks for having me.
Thank you. Thank you for honoring this my invitation. So let's start now because we have a few things we want to get through. Following the just concluded International Cancer Week of the Nigerian Cancer Society, and the Nigerian Cancer Society, leadership changed, and it's a privilege to actually welcome the new president and CEO of the Nigerian Cancer Society, Prof. Abidemi. Prof, can I just call you Prof. Abidemi as we all call you on the space because it's going to be hard for me to be doing all the other things. I hope you don't mind. Don't tell me you're frozen. Have you frozen? Can you hear me? Uh, can you hear
I
me?
can hear you clearly. I can hear you.
Okay, because you're not responding. That's why I was asking. Okay, so let's keep going. Also, I need to announce that the first cancer-led conference organized by cancer patients, by cancer patients, for cancer patients across Nigeria is holding in the next few weeks, and we're looking forward to that. So, for all of you out there, just remember that. Keep us in your prayers as we start a new term in our own space as well. November giveaway is now ready. 50,000 naira to anybody who has cancer. Go onto our Instagram page and go, but you must be able to prove you have cancer. Um, um, 50,000 naira. So watch the page. Go on our Instagram page. It's for anybody. At least we've paid it off and we can continue to get donors. Thank you to our donors for all you're doing. So let's start this conversation because I want to start and finish, get through as much as we can. So together we fight, together we win. Let me introduce our guest first. And as I said, it's Professor Abidemi Emmanuel Omonesi. He is the president of the Nigerian Cancer Society, an associate professor at the University of Medicine Ekiti, University at Ekiti, and a visiting professor at the College of Health Science, University of Liberia in Monrovia. Professor Abidemi is a meticulous physician and renowned scholar of over 20 years experience. His research interest in oncology is oncology, and he has numerous prestigious scholarships, fellowships, and grants from University of Florida, USA, Oxford University, University of Yale, the Bill Gates Foundation, Mayo Clinic, amongst others. He has published over 80 articles in both local and international journals. So it is my great honor and privilege to actually welcome you to this particular edition of Let's Talk About It, Cancer. Thank you. Together we fight. Let's go now. Prof, are you with me?
Yeah.
Are we ready for the questions?
Ready? Yeah, I'm ready.
You're ready to start helping us to get an understanding of what we're going to be doing and what we're expecting from you, right? So let's go with the first one, and I'm going to ask you simple, straightforward questions, just so that we can at least. I think the cancer space need to know who you are, and I think you also need to you will be able to tell us who you are. So let's go. What's my first question? My first question goes: what inspired you to take on this role as president of the Nigeria Council, and what do you hope to achieve? Yeah, let's start like that.
Thank you very much. Well, as I've said, I've been in the cancer space for time. Primarily I'm a pathologist. I know pathologists who make diagnosis of cancer. I'm also a cancer epidemiologist. I pioneer and set up the cancer registry in Ado-Ekiti, Nigeria, and that cancer registry is one of the leading cancer registry in Africa. where we are recognized by WHO and contribute data for the global cancer statistics. I'm also actively involved in cancer research, my numerous collaborators. So the passion is there, the interest is there. It's also my research focus, and as pathology, we make diagnosis of cancer, virtually every week, every day. And then we also look at our data, across cancer industry. So that interest is there. And one major issue that we have with this country is that the burden of cancer is increasing. Before now, we have issue with communicable disease. But what we have in the country now, we have the ethnological transition from communicable disease to non-communicable disease. And very prominent there is cancer. You also, I'm sure you're aware that cancer does not respect any age. Children have cancer, adults have cancer. The rich also have cancer. Virtually everybody have been affected by cancer. So it's a major public health issue in the country now, which I think should be addressed squarely. So based on my research focus in pathology, I joined Cancer Society, Nigerian Cancer Society about 7 years ago. I was actively involved, and contributed a lot to some of the strategies that we have at the moment, and I served in the last administration as vice president. The vice president, immediate past, president and CEO of Nigerian Cancer Society, Dr. Adamu Alasan Umar, empowered me to chair quite a number of committees, and particularly I chaired the strategic committee, that actually developed the strategic plan for the Cancer Society. So with that, I think that, having shared that committee and also mobilized support from the Cancer Society, that, organized my interest, to contest at the last election. And luckily, the majority think that I have the credentials to the association to renew that.
Don't worry, we do believe that you have the credentials. Don't worry. Even people like us that are not in Nigeria, we can tell you we're behind you all the way. So let's keep going. So now we're going to the next one. I'm going to ask you. So what is your vision? You see, the cancer space for most of us as patient survivors. So we are your specimen. We are the medical space specimen. Let's put it that way. So we want to hear what your vision is for the group, for the space, but also with an interest for ROS patients, because for some strange reason, we've always been left behind. And we want to be not left behind. We want to be on the table with you guys.
Yeah, thank you very much. Well, my major priority, I have area of interest. My predecessor has done very well in creating national awareness and also establishing a very solid base for the Nigerian Cancer Society. But we must take it on from there. We need international visibility. The Nigerian Cancer Society actually is the foremost cancer society in Africa, the largest by member. But along the line, there were issues with the society, and we have some other African nations, trying to just aside. But we're trying to launch back, so that internationally people know that the Nigerian Society is the foremost. But also the internal restructuring, as we have noted, will not be involving our cancer survivor, most of our decisions. So our plan is to involve them. And luckily for us, in recent years, we have one of the cancer survivors member of my ESCO, and my plan is to involve cancer survivor in all strategic levels, including the board of trustees, because we plan to also rejig a board of trustees. We're going to have at least one cancer survivor, as a member of board of trustees. Then our statutory committee also, and also our adult committee, I'm going to ensure that we have cancer survivors. Because the truth is that we cannot continue to discuss about cancer and cancer patients, and they are not there to contribute their view. So I think we need them. We need to hear from them. Then they contribute, tell us, what are the issues, and we can, speak, on their behalf. So apart from that, over the years, in the last 10 decades or so, people think anytime talk about cancer, it's only breast, it's only cervical and prostate. But we know, I mentioned to you, I funded the cancer registry. From the data across the population of cancer registry in the country, including my cancer registry and Agriculture, there's a trend of some cancer that government and people of politics does not take into consideration. For example, childhood cancer. If I was in Abuja last week, and I interacted with some of the politicians, and some of them mentioned to me that they don't believe that children have cancer. Can you imagine? Healthcare, policymaker, politician, people highly placed, they don't believe that children have cancer. So my administration will, bring to fore, the issue of children cancer, childhood cancer, very important because quite a number of children are having, cancer, particularly in Kenya. And the burden is there. And what we're trying to do is to assess the burden of, childhood cancer in the country. And we've succeeded in setting up for the first time in the history of this country a child specialized cancer district, in Lut, Lagos. The idea is for us to have data, and from there, we analyze blind data and know, what to do. Because that data you cannot, plan a very effective intervention. Then we also, consider colorectal cancer. We're not talking about colorectal cancer, and unfortunately, we have increasing burden of that cancer in the country, and that is, stand to reason because of our, sedentary lifestyle, then transition to westernized, diets and lifestyle. That is a burden. From our data from public cancer history, we see that colorectal cancer is also a cancer of concern to us, in Nigeria. So we need to create awareness about it. What are the contributing factors? Bring the attention of the government to it. We must also plan. As we plan for, prostate, breast, and cervical, we must also, take into consideration, colorectal cancer. We also talk about ovarian cancer also in the females. It's also, becoming increasing. I think that we also need to do, something about that. So those are cancers that, in the past, people have not given serious consideration. And lastly, hematological malignancy. Well, also known as cancer of the blood. It's becoming a major cancer in the country. It's uncommon. But people don't even mention about hematological malignancy as if it doesn't exist. But we know that it's a cancer of concern in the country. So in the next 2 years that I have the privilege to lead the association, those are the 4 major cancers that will create serious awareness, and develop strategic plan, also involve, stakeholders to see, what we can do to address that cancer. So we're also going to promote cancer research. I mentioned to you, I'm a cancer researcher, and I have, quite a number of international collaborators. We're going to promote cancer research because the truth is that we cannot continue to depend on, foreign, researcher. Particularly in clinical trial. Many of those drugs, that we have available for, treating a cancer patient, they are not too effective in the blood because of issue of genomic diversity. Most of those drugs were actually tested on the Caucasian, on the white, and we don't expect 100% efficacy in the blacks. So we have, the results in one power, we have, the backup, we have people in that space, both the pathology, the oncologists, cancer researcher, the bioscience, scientists. We have, people are members of our society that are able to, carry out landmark research. So my plan is to promote research, through application for grants. We have internal sources, tech fund, for example, in the country, then international grants, we apply for such grants, to ensure that we encourage, research along this direction, promote clinical trials, let's stimulate our cancer researcher, so I can also discover landmark, results that can also help our patients. So it's important we promote that. Then again, we must give opportunity for publications. For example, we have a number of people in the academia, as members of society, people have to publish from their salary. So one platform to encourage people is also to ensure that we, float a journal. We're going to float a journal, which our members, and Nigerians can publish free of charge. We're going to charge for publication fee. The idea is to encourage people to publish, their experiences, publish their work. But whatever is not published is not done. So we must, give that platform for publication. And one major issue we have in the country, that we must address is the issue of patients present with advanced stage of cancer. In most hospitals, that trend has not changed. Be discussing it at several of our meetings for more than 10 decades, but patients still present with stage 3, stage 4. The matter they present in the hospital, there's practically nothing can do but palliative. So we must, stage that strategic, campaign to the grassroots level. And in my little, survey, I discovered that most of the campaigns, that have been happening over the years, people do jamboree in the cities. People do jamboree, cancer work in Abuja, Lagos, and Port Harcourt. But majority of Nigerians inside the rural community. So our plan is to take this cancer awareness to the rural community, through our CSOs. We have our CSOs, civil society organization members of society, those are cancer focused in virtually all local government in the country. So we're going to work closely with them, and our plan is to organize a workshop, because people also need to know how to disseminate information. They may have a message. If that message is not properly communicated, that can destroy, people receiving the word. So we need to train them, that also cancer is how to, campaign. But apart from that, we must involve the community. Community involvement is very important. For every community, you have opinion leaders. We must identify opinion leaders in various communities, train them, and through them, we can pass across the appropriate information, to the populace. So my major focus, will be to bring, to downscale, this campaign to the rural areas. And we have the structure already in the country, political structure. For example, we have the state, we have local governments. Now we have been very active at the national level. So our plan is to activate the state chapters. So we have Nigerian Cancer Society, FCT chapter, River State chapter. So activate the state chapter. They will now downscale to local government. So that what we are doing at national level, we can, scale down, through that political structure to the local government. Then the local government can take it out to various communities. The one important aspect of cancer awareness is also, ensuring that the information is in people, different languages. Nigeria is a very complex society. We have several tribes, and languages. Cannot continue to, create awareness in English or major languages. If you're in a state where they speak, for example, Kanuri, for example, you should be able to downscale, translate, get a good translator, so that information is passed, to people in their various languages. That is where people can pick what we are saying. So we need to be more aggressive, on our campaign, because a lot of our patients present, advanced stage of disease. There's a lot of myths, a lot of, misinformation about cancer. Some people, think if somebody has cancer, it's infectious. All manner of, negative, perception, stigmatization. All those things we need to address. And the only platform, for us to get this addressed is, through proper education. People must be educated about cancer, the cause of cancer, prevention factor of cancer, and also way of preventing cancer.
Thank you. Prof, you answered all my questions, but in a very structured way. That's how I can tell you're an academic. It's like you answered an exam paper. But let's pull out your key points, because they're actually key points that resonate with us that have the disease and resonate with us that campaign for the awareness on people with the disease and those who make decisions. Because the first thing you talked about was the types of cancers. Very interesting, because if you sit with cancer patients across Nigeria, as you know, this thing for me is not, because I have metastatic disease, I think that it's no longer about breast cancer for me. It's about cancer across Nigeria, across the world, across low middle income countries. And so when you are talking about it, I'm thinking, wow, is it that he has gone on homework, or what exactly is going on? But really, the cancers you picked were a concern for me. And I don't know if I told you, but when I was in Abuja, I actually went to do cancer awareness in the IDP camps with the children. And it was because of what you just said. Children are a tool that if we don't use them, we're just wasting our time. We need to start recognizing that they will talk to their parents, and their parents will make an impact. Things can change. And looking at the work that you've started already, honestly, I want to say that yes, we are rooting for you. I'm not going to lie to you. We're really looking forward to where you are. But looking at everything you've just said now, it's like you just addressed our key concerns as patients, where these things across Nigeria and as a society across Nigeria, we're trying to get our first cancer conference together, and we're trying to bring patients from across Nigeria, not Lagos or Abuja, intentionally, because it's not about Lagos or Abuja or Port Harcourt, like you rightly point out. It's about Nigeria. So really, you are really, really talking to us. So I'm going to ask you one last question, and this is a question for you to tell us. What is your main message that you want to convey to every anybody in the cancer space that has to be able to come on board with you so we can walk this journey together? You see, for me, it's too important for us to make a mistake here. It's one chance. I was speaking to the Cancer Research UK yesterday, and I'll come back to you on that conversation because I think we have to talk on it. But yes, what is your question? What is your message? All of us, all stakeholders, How do you want us to carry this thing and run with you? Because we're going to run with you.
Yeah, thank you. Thank you very much. Well, it's so for my government to be that of continuity and consolidation. I said I serve as the vice president to the next past, president will have a strategic plan. So all stakeholders should be carried along. And then what I try to do now, the ESCO, the NEC, will be meeting, trying to bring everybody on board. But beyond that, we also call for strategic meetings. The society, we have, different interest groups. For example, you have, the CSOs, we have the cancer survivor, we have the volunteers. So our plan is to meet with this strategic group, to tell them about our vision, to also hear from them. But sometimes as leaders, you may have your plan, but you must synchronize your plan, with that of your followers. So what we are trying to do is to hear from them, what are their concerns, what kind of society they want us to build, and also, let them know our plans. They can synchronize, our agenda. So we have a common agenda. So become our agenda. So once we have that, I think that all stakeholders, will buy into it. But the truth is that we need to do more, for Nigerian patients. The gap is still there when it comes to cancer, in awareness, cancer diagnosis, cancer treatment, and also, follow-up. So we need to do more, in the cancer space in the country.
Thank you. I really, really appreciate you for giving me your time this early morning. Thank you for joining us, and we are all behind you, cancer patients and the cancer space at large. I want to say I really appreciate your time this morning, and please, I'll come back to you on a lot of things that we have been talking about very soon. Thank you for joining us this morning, and to all our viewers, I want to say this is November, we're getting to the end of the year. A lot of things are happening. Please be mindful. Go to your doctors, see your doctors. Please don't miss your treatments. I know things are hard, but just seek for help. So follow us all on our social media handles as various activities are going on, and we will be sharing with you. Together we fight, together we win. Common Cancer Foundation, subscribe, click, and this video will be out on our YouTube page, or our YouTube channel very soon. So please get yourself back on track, supporting us. And those who want the 50,000 cancer patients, it's up for grabs. So just go and look at it and get yourself on board. Prof, thank you. Have a fantastic day, and I look forward to seeing you again soon.
All right, thank you very much, Dr. Denise Ejo, and of course, Professor Omonisi. We thank you very much for that time. Moving on now to our next conversation.
Our message is very clear. Together we'll fight, together we win.